Hello, it's Dr. Ghosheh again, and I wanted to talk to you about a very common problem that has been afflicting our patients of late. And it's bizarre. I don't know why it seems like I have so many patients the last few months coming in with complaints of a stye. In reality, it's not a stye. A stye is an infection of the eyelash. They're coming in with something called a chalazion or chalazion, depending on how you want to pronounce it. A hordeolum is another term that patients use, and that is an infection of the meibomian gland. That's the gland that sits behind the eyelashes, upper one and lower eyelids. And there's several of them. And they're common. Patients always say, oh, I threw away my makeup, I cleaned my pillows, I changed my shampoo. And the reality is it's nothing to do with that. A lot of it is just body chemistry. It's like saying, well, how come I get acne? I clean my face all the time. It's nothing to do, like I said, the person per se. It's a chemistry issue, like I was mentioning. There are some risk factors. Of course, if you have something called rosacea, where your skin is, very pigmented or very susceptible to burning, or red. A lot of patients who have Caucasian backgrounds, have that sort of tendency, and that can afflict your eyelids, and it's called ocular rosacea. Another risk factor is called blepharitis. That's where patients get discharge or crusties on their eyelashes. Sometimes it's gucky and they have to clean it in the morning. In any case, if you have either blepharitis or a chalazion or any of these problems, the mainstay of therapy is to do hot compresses. Hot compresses at the sink with a towel is one way of doing it. They do sell over-the-counter masks called brooder masks, or several variations on Amazon and the like. And these are heated masks you put in the microwave, and they have an elastic band, and they hold pressure on the eyelids and maintain heat longer with a little bit of pressure. The heat followed by pressure does express the oil glands. In addition to cleaning the glands and having the glands stay more open, it will help with your tear film, because that oil is important for evaporative dry eye. If you get a chalazion, the first main thing you need to do is do the hot compresses. You will have pain, you will have tenderness. It's rare I will put patients on antibiotics right off the bat, because these infections do tend to clear just with heat massage. In addition, you can do baby shampoo, or they sell pre-soaked OcuSoft lid scrubs, and some other manufacturers have them. They basically clean the lashes, and they are like acne pads, safe for the eye. When do we intervene? Well, if your chalazion's in pain and discomfort, we definitely don't do anything at that time, because it's going to be very uncomfortable to get a shot for anesthesia, and it's going to be very uncomfortable to have the minor procedure to clean it out. However, if 1 or 2 weeks goes by and you find that you are still having a chalazion, then the next step would be to do either a chalazion excision, where we numb the lid, we put a clamp, and we clean the lid out. Sounds very barbaric, but it's quite common. It's simply an elegant way to pop a zit, but the zit happens to be in your eyelid. Another option is to do a steroid injection. Again, you'll have to feel the pain of the injection of the steroid, but it does tend to be successful, and sometimes we do that as a backup option if patients are a little bit more afraid of having strong anesthesia or a procedure. So those are the things that are common with the eyelid in terms of infection. If you have concerns or questions, or you're unsure, you can always call us and we can talk to you and give you a more personalized answer. Hope you're doing well. Take care. Bye.